Good morning, everybody. Son?
Yeah.
All right. Good morning, everybody. I'm Grant Colfax, Director of Health here at the San Francisco Department of Public Health. And thank you for joining us this morning for some sad news with regard to overdoses. It's been a tragic year for overdoses because more people have died this year than ever before. And we are not alone in this situation. Every 4.5 minutes, someone in the United States dies of an overdose. This local and national crisis is driven by multiple factors, including egregious pharmaceutical marketing, poverty, systemic racism, siloed treatment systems, and decades of underinvestment in behavioral health care. Last year in San Francisco, 806 people died of accidental overdoses, according to preliminary data released today by the OCME. 52 people died of accidental overdoses here in December 2023. This is a decrease compared to December of 2022, when 75 people died. Approximately 50 fewer people died in Q4 than in Q3 of 2023. And approximately 25 fewer people died in Q4 than in quarters 1 and 2 of 2023. But these reductions in deaths in December is not something to tout in a year with a record number of tragic deaths overall. Every person who died was someone's loved one, a child, a sibling, a life partner, a mother, a father, a best friend. Overdoses have devastating, far-reaching impacts on our community. We worked hard in 2023 to save lives, and we will continue to do so in 2024. We will continue to break down barriers to treatment because treatment works. We will maintain our strong focus on increasing treatment options and making them more accessible. The fact is, opioid use disorder is a chronic medical disease, like diabetes, heart disease, and should be treated as such. Not all people with diabetes, for instance, receive the same medication, treatment, or care. And the journey for recovery from opioid use disorder looks different for every person who uses substances. That is why, here at the department, we've been so committed to expanding access across the continuum of care. From substance use prevention to residential treatment to outpatient treatment, we have programs for people at every stage of substance use and recovery. We have a robust treatment system of care for people in San Francisco with behavioral health disorders. For instance, in our primary care system alone at DPH, over 25,000 people are receiving care for behavioral health disorders. In our specialized behavioral health system, over 15,000 people are receiving care for behavioral health disorders. But San Francisco alone cannot solve this problem of record overdose deaths. We rely on our city and community partners, our legislators at the local, state, and federal level to join us in this moment to continue to tackle this crisis. We call on our legislators to make greater investments in behavioral health care, both mental health and substance use treatment. We call on them to eliminate barriers to safe consumption sites, to access methadone, and to make all treatment more accessible. We call on them to make meaningful nationwide investments in the behavioral health workforce, which has unfortunately steadily eroded over the past decade. We cannot deliver services needed if we cannot hire and train a workforce. And now I welcome to the podium Dr. Hillary Cummins, Director of Behavioral Health Services and Mental Health SF, to speak more about our efforts to save lives from overdose. Thank you.
Good morning. Thank you, Dr. Colfax. As Dr. Colfax just described, our mission at the Department of Public Health is to reduce fatal and non-fatal overdoses in San Francisco and to reduce disparities among Black African American community members, people experiencing homelessness, people living in city-funded housing, and other communities disproportionately affected by overdose. In 2023, we expanded treatment services and worked to make access to treatment easier, whether from the street, from shelter, or from and within supportive housing. These are places that we see people overdosing at disproportionate and highest rates in the city. In 2024, DPH will continue to expand treatment access and implement programs to help people get into care and to help us understand and respond more effectively and more timely. We will continue to push forward with innovative and scientifically tested interventions, social support systems to treat the whole person, and address underlying factors in the disease of addiction. In particular, we will expand access to methadone and buprenorphine. These are the two medications proven to reduce a person's risk of dying of overdose. We are spreading the word about their availability throughout the city. We will continue to deliver these life-saving medications to people who might be living in high-risk settings like permanent supportive housing, in our city-funded shelters and navigation sites. And importantly, as you will be hearing after me, we will continue to conduct outreach to people who use substances in public settings to offer treatment, support, and navigation into increasing their care and treatment. We will continue to distribute the medication naloxone, which is the antidote to for a person experiencing an overdose, and continue to train people in our communities how to recognize and respond to an overdose using naloxone. Last week, Mayor London Breed introduced legislation that will remove hurdles to acquiring behavioral health treatment beds that will enable us to move more quickly to acquire new and needed services. Last month, we entered a national program to monitor San Francisco wastewater for fentanyl, methamphetamine, and other substances to track trends in substance use in our city. This last year, we tripled our street care teams, enabling our staff to work with people they might encounter on the street who have substance use and other behavioral health needs. We know from countless examples that treatment works, recovery is possible, and possible for everyone. Today you will hear from two people with lived experience with recovery who are working tirelessly to help other San Franciscans. I'd like to welcome to the podium first Tyrone Martin, followed by Britt Rubin.
Thank you. Good morning, everyone. Again, my name is Tyrone Martin, Tyrone Martin. And I am a peer supervisor along with DPH. That's our neighborhood-based street care team. And our team consists of behavioral health clinicians, health workers, and like me, who also spend a lot of time in the neighborhoods, primarily in the TL, Soma, South of Market, and we're experiencing homelessness, mental health, and substance use treatment. We coordinate with other outreach teams specializing in post-overdose care and physical health, and we're often joined by nurses and doctors in the field. And I really want to point out the dynamic of our team. Very skilled, specialized, have information, and like it was mentioned, lived experience. Myself, many years ago, as a young youth, I was addicted to PCP. So now I'm in full recovery, over 27 years, and I account that for encountering outreach teams, families and friends, outreaching me. That's why I chose this field. I experienced compassion. I want to give that back. Although it's not linear what we do, there's many shifts and changes along the way, along our journey as we're outreaching. But one thing I will say that when there is genuine, authentic outreach going on in the TL, especially in the TL, there's success. Meeting individuals where they're at. Our team is client driven. So each day we go out and we locate our clients. We have a care plan set up, exactly what the client is asking for, and also our behavioral health clinicians has assessed. We want to give them the highest quality of care. That's our objective. And although we are out there outreaching, it's not just about pumping information, it's about meeting them where they're at, and hearing their story. And I have the opportunity to share my story. We want to gain trust in our community, and this is a great way to do it, and I applaud our team in doing so. By being consistent and persistent on our part, I believe this success, it is very possible. It is personal to me. My mother was addicted to crack cocaine, and she suffered. She suffered. But I know today, where there's compassion, there's consistency and persistence, and there's support, we can overcome what we experience each and every day. So thank you.
Good afternoon, everybody. My name is Britt Rubin, spelled B-R-I-T-T-R-U-B-I-N. I am a certified substance use counselor who is also working as a peer specialist on both the street overdose response team in collaboration with the fire department, as well as a peer supervisor on the post-overdose engagement team, also known as POET. People who have survived an overdose are at a very high risk for experiencing a fatal overdose. POET is working hard to prevent them from being a statistic. When people who are unhoused experience an overdose, the POET team attempts to connect with them within 72 hours of their overdose event to offer them substance use treatment and other forms of support and connection. Like Tyrone mentioned, connection and trust in an authentic way is key to really being able to help people. Unfortunately, the reality is most people will decline treatment on our first, second, third, even 20th attempt, but we don't give up. People need a lot of support, sometimes hand-holding due to all of the distractions and underlying factors that come with chaotic substance use. Things such as housing instability, unaddressed trauma, mental health challenges, generational trauma. Again, we don't give up. Getting people into treatment, whatever that means for them, is the long game. It's often a long game. It requires building trust and rapport, meeting people in the moment that they're ready to take steps toward recovery. Sometimes that window, that moment, is very brief. So capitalizing on that, when people are in that moment of change, they're accepting help, we want to be there. DPH street teams coordinate with each other and providers offering withdrawal management to meet people in that moment. Like the BEST team, the POET team collaborates with a variety of providers, therapists, social workers, doctors, nurses, community health workers, and peer counselors like myself. Recovery looks different for every person. For myself, I am also someone with lived experience, so this is also very personal to me. I used opioids for the better part of 20 years and experienced countless overdoses. I lost my partner to an overdose. I was almost 50 when I began my recovery journey from my own opiate use disorder. So with that, I feel like I am living proof that it's never too late to recover. Treatment does work. I think if anyone who knew me when I was deep in the chaos of my addiction, no one would have ever expected that I would have stopped, let alone lived. Treatment looks different for everyone. For myself, it was a combination of support. We can't do it alone. That is for certain. I utilized and continue to utilize the medication buprenorphine to maintain my recovery. It is so essential for people to have connection, support, community. We need people to stay alive in order to accept that support, to make a different choice. There's always an opportunity for someone to make another choice, but they have to be alive in order to do so. As long as someone has breath in their body, I believe they can recover. Thank you.
I think we have some time for questions.
Yeah, I do. For the two people that experienced all this, well, for me it was interesting. You said authentic. Does that mean like certain organizations did things differently, or like what exactly did you mean by that? If you want to stand on the podium.
Sure. I was speaking from a personal experience. Even in my life and my struggles, because there's a lot of distrust. I think if you are authentic and genuine, meaning I was willing to be vulnerable to share my story, even today when we're outreaching, if they're willing to listen, of my struggles and what I went through, my recovery. And that's what I meant about being authentic, being vulnerable, being open. You know, for me, I'm no different from them. They're citizens. That's our community out there. I'm part of that community. They're part of my community. So let me sit down with them and let's talk.
The trust.
The trust.
And then for the recovery process, I know everybody's situation is different, but like, I guess on the average, how long does it take for one to recover, I guess? Like, is it?
Well, I can't speak to everyone. I'm still in recovery. Recovery doesn't just stop because I stopped using it. There's still boundaries I must set up. You know, we gotta, it's every day. Because at any given time, you know, relapse is possible.
Yeah,
but there's a support system. That's why we have a support. Our team, it's just not a warm handoff and that's it. No, we continue to follow up with our clients. We want to continue to show them that there is support, and that support is not going away.
So it gets less and less, I guess. For example, you said like 20 years it took you to recover, right? Is that what you said?
I'm still in my recovery.
You're still in your recovery, so every year is like less and less, or how does, if you could kind of talk about that a little bit?
Yeah, well, it's a continuance. You know, you have to have your, you know, you're still dealing with your coping mechanisms. You're still dealing with your support system around you, your fellow, comrades, if you will, that are there to support you and encourage you. So it's a continuous thing.
Christian, did you have any?
Yeah, Dr. Colfax, just wanted to go over the numbers from last year. That they are alarming. If I recall correctly, it's 3 times the amount or so than we saw even 5 years ago in terms of our overdosing. So first, I wanted to get a sense from you talking about the scope of this issue, but then also talk about what we saw in the last part of the year where we started to see those numbers decline. Is this part of a trend, and do you know what could possibly be leading to the lower numbers or the decreasing numbers as we approach the end of 2023?
Yeah, so just thank you, and we can get you the numbers overall. Just so in 2020 we had 726 overdose deaths. In 2020, in 21 and 22 we saw some decline, and now the numbers are back up. So I think most recently, I mean, we're the numbers being lower in December compared to last December, I think we have to, gives us some hope, and also we have to be cautious, right? Because these numbers can vary quite a bit month to month, and so there's the variability. I think that's why we continue to ensure that we are have our teams out on the street, and I've been out with the best team and seeing them work on what they do. I mean, that program is, we're expanding the hours, we're expanding access to treatment, and Dr. Cummins can talk a little more specifically about what we're planning to do more of in 2024. The fact that, we distributed nearly 125,000 doses of naloxone last year, which is higher than any other year, is a significant issue as well. And the fact that we continue to expand our treatment options for people, right? There are new hours that we've implemented at our behavioral health clinics, and the fact that we're doing more to get buprenorphine and methadone more accessible. In some of our clinics, we're seeing methadone treatment rates go up as well. So we're doing whatever it takes to get people access to treatment and to make sure that they know treatment is available, meeting them where they are, but not leaving them where they are, supporting and lifting them up as much as possible.
Without getting into the politics of it too much, I'm sorry, I saw there's another question. I just wanted a quick follow-up. I know that the mayor and the district attorney's office have both made a real push to try to stop fentanyl dealers and try to reduce the number of dealers in the city, and have taken up the controversial policy of sometimes arresting or detaining drug users as well, in the hopes that would then get them into some kind of treatment, perhaps if they are arrested or jailed or something like that. Wondering if you see if the numbers that we're seeing decrease could be a part of this policy, part of the crackdown on dealers in San Francisco. Is that what we're seeing going on?
So we're physicians and clinicians in public health, and our job is to ensure that there's treatment for people available no matter where they are. So we continue to expand our treatment services, working with law enforcement partners to make sure that people know that treatment is available. We have a robust system of treatment and care in our jails, and that's our focus. And so we continue to make sure that people know that methadone and buprenorphine are life-saving, that there are connections and counseling available for people to help support them, to come back to their appointments, to engage in their appointments, and also to make sure that people have the naloxone, because as already been mentioned, saving life is the first priority, and then community treatment is the next. And that's what we really want to make sure that we're emphasizing across our system of care and across the city, no matter where people are or find themselves.
It'd be great to hear from somebody on the street teams about this, but you're also welcome to answer. I'm wondering, we've seen an uptick of xylazine being linked to overdose deaths. Are you seeing people actually seeking xylazine out, or is that a result of xylazine ending up in other drugs that people were already using? I know in Philadelphia people are really actively seeking that drug out because it prolongs the effects of fentanyl. Are we seeing that here?
Yeah, you want to speak to xylazine?
Yeah, and then thanks for the question. I just, we did in San Francisco, just to be clear, see an increase in overdose deaths involving xylazine this past year. All of those deaths also involved fentanyl. So I think for this press conference today and high numbers of people we lost to overdose, more than 80% of those overdose deaths, it did involve fentanyl, and all the instances of xylazine involved deaths also had fentanyl in the person's body when they passed. Let me turn it though to your other question and observation about Philadelphia and what we're seeing here.
Xylazine was a contributor, it wasn't the main driving factor.
It was a contributor to the death, yeah.
I understand.
If you won't even want to answer it, you don't have to if you don't want to.
I mean, I
Can you
think,
get the podium, please?
I'm sorry. So I think one of the things that is often, I say, a superpower of people that are peers with lived experience is that we, I just have real talk with people that are in the substance using community about like, hey, what's going on? Have the drugs changed? Like, is it is this what you expected? You know, is this, you thought you were seeking, fentanyl and it might be something else. I think that, from what I understand in my conversations, I mean, that people are recognizing that xylazine or tranq it's present. It's a different and differently more potent high. So people are aware. There's different combinations of things out there right now.
Yeah, so I'm curious, this might be a question for Dr. Kovacs. I know that there's been some discussion about the opening of certain wellness hubs in the city, particularly since the closure of the Dandelion Center last year, and I'm just curious what the status of those wellness hubs are, especially considering these numbers.
As I think Dr. Colfax mentioned in his remarks, there is public health evidence for using supervised consumption as one of the public health tools that could potentially have an impact on overdose deaths. Right now, both the state and federal legal context makes that difficult to pursue that in our jurisdiction right now. And so we are hopeful for changes, and we will look forward to them.
I think one of you mentioned that the street team capacity has tripled over the last year. Can you just clarify a little bit more what is that capacity, how large is it, and is it fully staffed right now, or is there still more to go?
I'm gonna get back to you with some of the specific numbers. What I will say, and thanks to the team members who are here today, that work has really evolved to include, and you heard from Tyrone, sort of a multidisciplinary approach with team members out and about in our highest need areas, with the sense of following people over time, consistency and persistence. That capacity has increased. We have hired a number of people. We'll get back to you on the staffing. There are team members available now 6 days a week as a result of the increase of staffing. And it is really a model, again, that we are proud of, that we see making a difference, approaching people over time, again, to use the great phrase, with persistence and consistency and authenticity, to pull people into care, to coax people, support people in recovery.
So one last one.
Yeah, question for all of, or mainly the street team. When you got these numbers, I mean, gosh, this is depressing for me to think about. It's grim. You work in this field. You know some of these folks. I'm just curious what you thought when you first got those numbers, if you can bring me back to that moment. And were there any sort of like, oh gosh, if we could only have done this, maybe we'd be in a different place or something like that?
You don't have to answer if you don't want to.
Well, I would just say this, when we look at the numbers are what they are. Does it affect us? Does it affect me? Yes. I will say that that's why we take a great effort in our team to support one another, and to also look at our goals. Our goals are the same. We want to provide the highest quality of care to our community, and that's our aim every day. But I do think DPH, Best Neighborhoods, they have applied and supplied us with the best self-care possible, so we can do the work. So that's what I would say. Thank you.
Thank you.
All right. Thank you all. Appreciate it. I'm gonna wrap up now.